Hey guys, this is Oba Achilike, CEO of Wellcare Nurses and Staffing. I'm coming at you again with another video. So, on today's video, we're going to discuss the difference between a home health agency and a home care agency. Yes, they're different. A home health agency is similar to a home care agency, but the work that the two do are completely different. Oftentimes, people usually get them, um, mixed up, thinking that they're the same, but no, they are completely different. So, in today's video, we're going to discuss the difference between a home health agency and a home care agency. We're also going to cover similarities between the two and opportunities that you can take advantage of in either side of the home care space. So, without any further ado, let's get right into it. So, what is a home care agency? As you guys can see, I'm wearing home care. It says home care right here. So, my agency is a home care agency. And a home care agency is an agency that would help people who are in home, similar to a home health agency. But the difference between a home care agency and a home health agency is that a home care agency provides non-skilled work, such as light meal preparation, bathing, dressing, grooming, medication reminder, assistance with transportation to and from medical appointments, grocery shopping, errands, assistance, and things like this to seniors who aren't able to do it for themselves like they used to, do when they were much younger. So this is what a home care agency would do. And a home care agency, the services are usually provided by a non-skilled worker. And there's a whole, difference between skilled workers and non-skilled workers. But this is going to be provided in home care by a non-skilled worker. Depending on the state that you're in, I'm here in New Jersey, the Garden State, and our state mandates that anyone who's providing home care, as soon as you touch a member, you need a license. So you need to be licensed as a home care aide, a home health aide. And there's a whole license process for those who are interested in getting certified to become home health aides in New Jersey. Other states require it as well. I believe New York does. Other states don't require for you to have a license. I don't think Pennsylvania does, but let's continue. So, a home health agency provides skilled care. And when we say skilled care, what does that mean? This means care that's provided by a registered professional, such as a registered nurse or a physical therapist or a social worker or an occupational therapist. And so this is the kind of professionals that are working in the home health agency framework. And how do these, what do they usually do? So let's get right into it. You may have a registered nurse doing wound therapy, wound care in the home, right? So, let's say the patient gets discharged, and they need to still continue receiving care, but they don't need to be in a hospital any longer. And so they come home. The doctor would not prescribe for them to receive home health care or home health, care, depending on what their needs are. And based on that, they may need wound care. They may need medication administration. They might need other types of, skilled care in their home. And it'll be more beneficial for them to be at home as opposed to being at a hospital. And they will prefer to be at home than to be at a hospital. And so this is what a home health agency would do. A home health agency would send out a licensed professional to be able to administer this care that's been ordered by a doctor on behalf of the member who is now in their house. So, a home health agency that provides the services, usually the services are, based on the member's need. And if the member no longer qualifies or it no longer needs it, then they won't receive it any longer. So home health, type of treatments tend to be short term. They tend to be provided by skilled professional who can be able to assist the member in what their needs are, their medical needs, right? So their medical needs can, range. Maybe some folks may have, different type of chronic illnesses that needs to be managed, and it can be managed at home. And so this is what a home health agency will be able to help with. Now, a home care agency won't really do this. They will send a home care aide or a home health aide who can be able to assist, or a caregiver who can be able to assist, with doing, helping the member to do things that they used to be able to do, but are no longer able to do anymore, or have limitations in doing. And so now, where these two are similar is both a home care agency and a home health agency. They both provide care for aged adults in their home, right? So that's the first area in which they are similar. Both are usually covered by insurance, but in the case of home care, that one is typically covered by Medicaid, or other long-term insurances, or waiver programs, or even private insurance. Whereas home health, the type of services provided by a home health agency, like skilled nursing, will be covered by Medicare, and other types of long-term, insurances as well. Um, and so these are the, similarities between the two. Now, you may be thinking to yourself, like, which one is right for me? What would I want to do? Now, if you're asking yourself these questions, you're asking the right questions, because it's important that you understand, which field that you like to be when, it comes to in-home care. Would you like to be on a home care side, or would you like to be on a home health agency side? And, just giving you some differences between the two. The licensing in states are different for either a home care agency or a home health agency. So it's important to, check in with your state, and see what their regulatory process is. Maybe you can reach out to your state's Department of Human Services, or Department of Health, or Board of Nursing, and they can give you more clarity on what you need to do. If you're here in New Jersey, if you're interested in starting a home care agency, that one will be handled under the Division of Consumer Affairs. And so they are the licensing and regulatory body. Again, now, so you have different opportunities here. You can definitely make money on both sides. You can actually combine both and provide a wide array of services, allowing you to be able to capture the entire value chain. So you can be offering physical therapy, occupational therapy, speech therapy, wound care, different types of medication administration, and also offering the same services that a home care agency would, like sending out a caregiver who can help Mrs. Smith with, bathing and dressing and the like. So again, it's really important that you have an understanding of what you would like to do. But these are the two differences between a home care agency and a home health agency. Now, if you still have any questions on this, you can definitely Google. You can also email me too. I'll leave my email in the comments section. And yes, I look forward to speaking with you guys again. And if you enjoyed this video, please, like, comment, subscribe, and I look forward to speaking with you guys again soon. Thank you.